and then eventually the dryness is so intense can give rise to pink eye and some kind of foreign body gritty sensation and things like that will follow.
When we do it in the salon, we ensure that it's not on the waterline and a little outside. Can they be reused?
Of course not. It's very painful area,
After every use, our brushes are clean. But when people at home use their brushes, they feel like it's their own brushes. So is it really required?
Contamination,
Right.
infection can spread, so beware of that. Cleaning is important. Like every girl's like to look beautiful and all that, although the beauty lies in the eyes of beholder.
Hi, doctor. Good morning.
Good morning.
So when I got to know about this Eye-conic series, we were really excited because we always get a lot of questions from our clients, and we thought this is a perfect opportunity. So we asked our family of 20,000 Instagram followers to place in their questions regarding eye makeup or everyday makeup use and products in general. So I'm going to ask you all of those questions today.
Sure, Priyanka. I would love to, give my whatever tips and pearls for you and for your clients. All ears for your questions and be all your eyes. Right?
Yeah. So I think so. The first question or the most asked question is, nowadays there's this trend of colored lenses, which we see a lot, mostly in the north, but now it's also in the south, and people are really fond of it now. So they were asking us, saying, is it okay to buy colored lenses online? Because I think there are a lot of sellers out there who are doing that.
Yeah, I will. Sure. But then, coming to the contact lenses, whether it is cosmetic colored or regular contact lenses, the principle holds the same. Where, they have certain fitting criteria. So it just cannot simply buy over the counter or online buying and all that. Primarily, the reason being the ill-fitting contact lenses, and then sometimes the solutions they buy, they may not be very appropriate to do such kind of things. So what will happen is you can have some infection. Sometimes while applying and all that, can scratch that black layer which is known as cornea, very delicate kind of tissue. So then you're prone for infections and things like that. So
I think
never
it's always
advise,
better to seek professional help before they just go and buy things online.
Yeah, in many optical outlets also, they can if not the eye hospitals, even optical outlets, there are professionals who can provide you with the properly fitting cosmetic contact lenses so that you can enhance your beauty of your eyes.
Understood. Yeah. That's good to know.
Yeah.
So it's not just a click and go. Yeah.
Right.
Another question is, which is probably like a lot of people use kajal every day, and I think it's been in our culture also to just like put kajal, or it's been forwarded since years. So is it really safe? A lot of us are raising questions now regarding saying, can I put kajal every day at home? Is it okay? Is it not okay? What are your thoughts on that?
Yeah, I remember, when bygone days, there's in these grannies and all this, they used to prepare their own kajal.
Yeah.
Yeah, at home. I remember that. And it was a norm. Every girl should have that, kind of kajal applying in the eyes, so to beautify or enhance the beauty of the eyes. But then over the years, we've been seeing this kind of pencil kind of stuff and, eyeliners and all that. So always, remember, we have very tiny glands arranged over the lid borders, both upper and lower lid borders. So these glands will help to prevent the evaporation of the tears from the eyes. And by doing, applying that kajal on that line, like away from the water line, what you say, away from that is the safest way. You can every day use that, but following this kind of, care where you should avoid applying there, so that you are not blocking your oil secreting glands.
Correct.
So what will happen if you apply there and, leave it like you don't even care to remove it before going to bed and all that? So they clogging these glands, orifices, and then eventually one will slowly develop what you call that dry eye situations, and sometimes the dryness is so intense it can give rise to pink eye and constant rubbing of the eyes and some kind of foreign body gritty sensation and things like that will follow. So you can wear, but taking this care.
Yeah. So when we do it in the salon, because we do so many makeups, we ensure that it's not on the waterline and a little outside. So,
Oh,
it
that
also,
sounds good.
yeah, it also makes your eyes pop brighter. So I
yeah.
think it's a good information for our
Right.
clients to know to avoid the waterline, but kajal is not a problem.
Yeah, every technical person from your end should understand where that line is starts from, and then avoid
Yeah.
applying there. Even your clients, you should, while doing that, you can please advise your clients as well that don't do this.
Don't do it at home.
Whatever
like this.
do's and
Yeah.
don'ts,
Yeah.
ask them to follow.
Yeah, yeah. Okay. So, talking about lenses, another very common question which we got was can these contact lenses, which they use for like parties or like these colored lenses, all of these things, can they be reused?
Of course not. See, reuse is always, see, everything has a shelf life. Usually, the contact lenses, regular contact lenses, there are disposable contact lenses, daily disposables, or bi-monthly disposable, something like that. But regarding these cosmetic contact lenses, also, if you have a such kind of arrangement, like it can be used for a month or so, it is reusable. If it is a daily disposable, you are using it for a day. On that day, a couple of hours or whatever. Next day, you cannot reuse it.
Yeah.
It's gone.
Yeah.
Suppose it is a monthly disposable or bi-monthly disposable, whatever. Then ensure that you clean it properly and it is dipped in a solution. That solution needs to be changed every day till you use it for another use, like for a month or so. You have to daily change that solution in the box, so that you can avoid this contamination or bacterial infections. Even any solution can harbor bacteria or fungus. You have to be wary of
Yeah.
that.
Yeah.
So
So I
this is
guess
what.
when people go to the doctor and then when they get contact lenses for like sight or anything, though those are the practices that are used for contact lenses. So I
Same
think
do's
you-
and do's and
correct.
don'ts of this.
Yeah.
So, and hygiene.
Yeah.
Very, very important is your hand hygiene.
Right.
Yeah, you have to clean your hands, and you're having all these. I know you do nail art as well,
Yeah.
so the long
Nails,
nails,
yeah.
and be careful.
Correct.
So when putting and applying, it can again that scratching the cornea or tearing of that tissue. It's a very painful area. It gives intense pain. So anyway, then you have to see an eye doctor like us.
Yeah,
Anyway,
I think
but
it's
you
important for them to know how to handle these in case they're reusable, how to keep them safe
absolutely.
and how
Yeah.
to
So
reuse
make
them.
them.
Got it.
It should make them practice
Yeah.
how to handle these things. Yeah.
So another very asked question was, so when we do makeup in the salon, we use brushes, but after every use our brushes are cleaned. But when people at home use their brushes, they feel like it's their own brushes. So do we need to clean them? Do we not need to clean them? Is it really required? So what are your thoughts on this? How often should they be cleaned?
Yeah. See, cleaning is important. Like, as we already spoke about the hygiene part, how the hand hygiene. See, brushes, reusing, and, maybe 3 times, 4 times. I'm not very sure of that. But then cleaning is very, very important. Like, again, same thing. So many bacteria around and all
Yeah,
that.
it's just because you're using it for your own
Yes.
self doesn't mean that it's clean and
Yeah,
you don't need to
one
clean
more
it.
thing is the lid part. It is the thinnest part, that skin there. It's not having fat over there. There's no
Right.
cushioning.
Right.
And these glands also very sensitive. See, these lids and all, they protect us from the outside dust and
Yeah.
dirt. So they are the protectors. There is that blink reflex. Something coming in, we suddenly close our eyes, right? So they are protectors. So you need to protect them. So you can't turn a blind eye to your eye care. Yeah.
Yeah.
So cleaning is utmost important.
Important, even if it's at home. you're using, you have to clean
Yes,
it.
yes.
Yeah.
You guys are really taking care of that. I think so. Some kind of sterilization methods, and you
Yeah,
follow
so we
for
in
your
general,
clients. Yeah.
because we use from after one client, we definitely sterilize our brushes, clean them with the cleaning agent, and then we use them on others. But these are things when you're using them at home,
Yes,
we
yes.
generally tend to ignore it a little bit because we feel
Yeah,
like,
yeah.
oh, it's ours, we don't really
Yeah,
need
yeah.
to clean
Sometimes
it.
sisters also they try to share things like siblings they
Yeah,
share,
yeah.
but as they says sharing is caring. But sometimes between the siblings also it can have that they can have this contamination,
Right.
infection can spread. So be beware of that.
Yeah.
So better to do it for you all. You
Clean
own
them
up
on
your own things,
regularly,
and
even at home.
even at home,
Yeah.
don't share
And
with
now there are a
others.
lot of brush cleaning available online,
Yeah.
and they're like it's become very easy. You get solutions, you get
Oh, okay.
lids. So I think that's something which everybody has to. It's part of personal hygiene to
Yeah, I
just
think it's good
completely do
thing
it.
you should suggest your
Yeah,
clients
yeah, we do.
when
We
they
always do.
approach. Yeah,
Yeah.
yes, right.
So another question is, we do lash extensions in the salon, and we always advise our clients saying you have to come back after the 2 week period to get it removed properly and everything. Of course, a lot of them listen to us, but there are many people who kind of try and pull them out at home and things like that, and we keep telling them also that it's not supposed to be done. But I think it's best they hear from you on the risks of pulling lashes at home.
Yeah. So these extensions are the false eyelashes.
Yes, yes.
So we have natural eyelashes
Correct.
there. Then along with that, you are going to apply.
Just apply a little more to
So
make
while
them
pulling,
fuller.
correct.
Yeah.
While pulling, the risk of pulling your natural lashes as well.
Correct.
And then again, of course they grow back, but then when you are doing that, there is risk of infection can happen, and you are losing certain gland integrity structure. So again, these glands they secrete oil.
Yeah.
So we are tear glands are located way inside, but these lashes they also grow from the base is again they are having coming out from these glands only.
Yeah.
All these glands at the lid borders as well, all oil secreting glands. So the function is to prevent the evaporation of the tears. So two way. See, doing this is done with a glue or something, right?
Yeah.
Huh.
We use a friendly glue, which is
Yeah.
we use them to just stick them off, and
Okay.
once the period is done, we just remove them with the removing lotion.
Right.
So it's a very safe procedure, and it's not
But
even
it should be done by
it should
you
be done
guys,
by us.
not
Like you can't
the
just keep
professional,
pulling
rather.
it out.
Yeah.
It's not good.
So what will happen that you should always look for those contents of the glue whether they are safe
Correct.
for the
Yes, yes. Yeah.
eyes or not.
Yeah.
Because certain glues, I guess, they have very strong toxic chemicals.
Yeah.
They can be irritant. It's any chemical is irritant to the eyes.
Correct.
Toxic, so it can produce allergies or infection. Both the things can happen. Either this or that, or both can be harm can be done. So while doing that, they should understand that they should not be doing by themselves. Approach you guys only for the removal.
Yeah.
Otherwise, this allergy or irritants or anything it can happen, because while pulling that can be spillover, or they can even harm their those delicate structures like that white layer is conjunctiva. It can be torn, or the cornea.
Yeah.
Others, it can go on, and then sometimes even the lid border, those glands can be disturbed, so that sometimes you see those ties kind of thing,
Yeah, yeah.
pimple kind of thing, very painful and all that, and these things can happen.
Yeah.
So suppose even if you while doing that, if it happens, like antibiotic drops to be given if you are allowed to, but you are not allowed
No,
to. So yeah, so you can use these tear substitutes. They are over the counter medications. Like they can soften and then can give you soothing relief to the client also. Even after removal, you can use those tear substitutes.
Yeah, in
After
case they
the
need.
removal of
I
the
think
eyelashes or eye
anything
makeup.
related to it, if they feel like sometimes something is irritating, it's always best to seek professional help.
Yeah.
And
But
they
otherwise,
do
tear substitutes, one can, get them over the counter medication only. That also can be used.
Got it. another very interesting question which we got was so when people come to us and we do their eye makeup, they're nicely relaxing and their eyes are closed and everything is sorted. But then now they're asking me, saying, when we go back home and do our own makeup, there are things always falling in our eyes. What do we do in that case?
Okay.
How do we handle this situation? So, what are your inputs on when makeup falls in their eye, maybe when they are applying eyeliner or anything? What are the steps that they
Yeah.
need to take at home?
Right. I know I've been seeing that even there's some kind of glittering things also people been using. Yeah. Yeah, it's a chance of falling into the
Yeah, I
eye.
think when you're closing your eyes and doing when we do it, because we're professionally doing it, they're just relaxing and they don't, like, once you're
No, I
open,
got
it's
your
done.
question. When
So
if
but
they,
at home you will open your eye and
yeah,
keep
after
seeing.
late parties and
Yeah.
all, they can't come to you. They have to
Yeah,
go home
yeah.
and do it by themselves. So best thing is, if they don't get panic, something, it's like a foreign body, right?
Correct.
For foreign article, like you feel very sandy kind of feeling, and you immediate reflex action is rubbing the eye. Please do not rub your eyes. Okay, just with the cleanse, thorough wash with the tap water itself. That's fine. So just splash water and try to clean it so that all the particles get washed out. If still not get stuck or anything, you have to see the professional only, because we look through a microscope and anything we can carefully remove. Or if you can see from outside, you take a earbud and you can, sometimes angles you can
Yeah,
see on the
correct.
mirror, you can remove that with using a earbud. Otherwise you have to see the ophthalmologist.
Yeah.
Majority times, washing with water, it does the job.
Yeah.
If not,
Yeah, because
using
it's
the
just
bud.
tiny particles
Yes,
which may
yes,
just.
yes.
So I think the first basic thing is for them to not panic.
Not
and
panic,
then rub
rubbing
your
the
eye.
eye. Rubbing
Yeah,
is
yeah.
should
Rubbing
strictly be
should not be
avoided,
done.
yeah.
Yeah, yeah. Okay. I think this is a very important question. So when we do makeup and when they do makeup at home or in the salon and everything, we always ask them to use proper makeup removers and either cream based or water based on their skin type. That's how we suggest it. But the question that I have got is, now when there are no makeup removers available, what any tips from you on what they can use to clean their makeup out?
Yeah, yeah. You have these baby shampoos.
Oh,
That they mention no tears.
Oh yeah.
So it's very safe for the eyes. Even we do advise our patients sometimes when they come with the dandruff-like thing, like I they can harbor a dandruff-like thing.
So it's safe.
So
It
same
won't.
thing, when you want to use the makeup, use this baby shampoo. You can a little bit dilute it with and take these earbuds and thoroughly apply and then
Clean
two
the
three
kajal
times
and
and
all
then
of that.
we use with clean water. That way, this is the best way of removing.
So
Yeah,
that's a very nice tip.
Yeah.
So because suddenly if
and
there's no makeup
inexpensive and
remover.
safe and things like
Yeah,
that.
yeah. That's nice.
Yeah.
So another very popular question which we got is, I think there are a lot of surgeries like LASIK or any kind of procedures to the eye. They're asking about how much gap should they give between that and then applying any eye makeup, or sometimes they have events, so, and they just have surgeries also. So what is the preferred time gap between an procedure and makeup?
Yeah, sure. Because nowadays it's not just for the cosmetic purpose, but it's such an advantage to remove glasses or contacts, so that they can see without these tools.
Yeah.
That's an important thing, and nowadays it's become very safe procedure. And yeah, but then when do we do makeup means, depending on the type of procedure also, at least minimum 2 to 3 weeks gap should be given. And when you do like different type of eye things, so if it is not coming into that eye thing, or sometimes I don't know, mascaras and all, so and the chances of
Any
going
kind
into
of
the
eye makeup, because
Yeah.
I think when they get LASIK done,
Yeah, eye
there should
extensions.
be
You
a
said
thing.
no, extensions and all. They should not be done. But having a eyeliner outside that thing is fine. Even after a week or 2 weeks, that is fine.
Okay, that's okay.
But these things, at least minimum 4 weeks is the way to go, kind of thing. If you want to put lash extensions or
Any
whatever,
kind of makeup,
any kind of
eyeshadows, yeah.
mascaras and all that.
I think it's better to be precautionary and then.
Yeah, 4 weeks usually. Otherwise, the eyeliner thing and all, I think even 10 days, 2 weeks, that's good enough, no
That's
problem.
fine. Okay.
Yeah.
Yeah.
And sometimes, you should be wary of that patient, sorry, it's always the word patient. So when the clients come to you for the makeup with the contact lens on, ask them to remove.
Yeah. Yeah.
You finish your eye makeup thing and then ask them to put on. So that is the safe thing.
Yeah.
Yeah.
So, another question that we have is that, all of these weddings and everything are usually early morning muhurtalu, manaki, and all of these things. They're like, my eyes are red. What can we do at this
Yeah.
point? So, what do you suggest?
Yes, and also they sleep very less.
Yeah.
Yeah, correct. There are certain drops like eye cool, certain things which are like an astringent. The moment you put one drop, that redness will go away and like nice pink, nice
And they're
white
over the counter. You can buy
over
them.
the counter. But excessive use of this, they're like an astringent kind of stuff. They dry up the secretions, so lead to dry eyes. So best thing is again to counter that tear substitutes. Again the way to go thing.
Okay. Another very interesting question which I got was, we have a follower who has asked us saying that they have worn contact lenses and have gone for the party, and after they've gone back home late, so this is a good 7-8 hours later, she couldn't find one of the lens in her eye. So in such scenarios, what is a person supposed to do?
Yeah. In fact, wearing for longer hours is not recommended, but on a daily basis. But now and then, like as you mentioned, this kind of situation, it's okay to wear that prolonged extended wear. If you can't find out the contact lens, try removing it. But if you can't find, then you have to come to us. Like sometimes it go and stuck under the upper lid. If you can see, you can pull it off, but otherwise we have to remove it.
Yeah.
Sometimes they just stuck, they get dry and I don't know.
Yeah,
we
definitely
have
a
seen
panicky
kind
situation
of
at that
situations.
point.
Yeah.
Yeah.
So don't get panic. You always feel that try to put some lubricant drops and all that to loosen it up. You get these drops, you can buy by yourself. No need
Correct.
for any prescription. It's not
Yeah.
a prescription drug. You can try all those avenues. So last resort is anyway we are there.
Yeah.
Yeah. And remember, suppose you could do it, you remove it and by yourself. Don't use that lens. Don't know you must have damaged
it.
the lens.
Yeah.
So better not to use that. It's not safe.
Correct.
Yeah.
Got it. I think, doctor, lastly, if you have to give one tip for all the makeup lovers out there, what would that be?
Yeah, like every girl's like to look beautiful and all
Yeah.
that. Why not? Although the beauty lies in the eyes of beholder, they say, but it's primarily the makeup that to the eye rather you are asking. So eye rubbing is the one which should be avoided, and also people who are prone for some allergies. Sometimes they may be allergic to pollen or dust. They keep on you can't run away from the dust.
Yeah.
So they get lot of itchy eyes and all that. Those people, they cannot stop rubbing.
Rubbing.
Because allergies are not curable. We can give them medication to give relief.
Yeah.
It is not curable. So suppose even if you are allergic to the chemicals of these eye makeup thing, so beware of that.
Yeah.
And try to use only one product which is always you've been using.
Yeah.
Don't keep changing the product. That is another thing, because allergy prone are we don't know, right? So, and infections also you have to keep in mind. You have to keep in mind about it, and so those products, how look for your expiry date and all that.
Yeah.
These things I can, as a clinician, I can say that.
Yeah.
Yeah.
So I think rubbing eyes is, when you said, that's a very nice tip. And also I feel like nobody will rub their eyes because they're scared their eyeliner and mascara will go. So I think it's a
Yeah.
good way to prevent rubbing eyes.
Of course, yes.
Yeah.